Good morning, good morning. Namaste. I see the divinity, the creativity in each and every one of you. I hope all is well this morning on Wednesday, the first day of July. And I thought that I would come on and talk a little bit about um, the idea of black male therapists and the need for more black male therapists to emerge, particularly, well, in general, but of course, particularly in uh, being able to see and treat other black males. I have been treating black males, conducting research with black males, teaching about black males for probably over 17 years, and even clinically throughout my training have treated a number of black males and currently find myself in the last couple of years probably treating out of my caseload in various places I've been. 95% of it has been black males from multiple developmental stages or ages. Um, and so I believe in it deeply. I believe in the clinical and spiritual and cultural utility and the reparative or corrective experience that black men seeing or black boys seeing being treated by other black male therapists can result in. This thought came to mind as I was reading a Facebook post where an African American female therapist was talking about a black male patient whom had shared that he had distrust or didn't feel that it would be a good match or a good fit if he had a black male therapist. And of course, this piqued my interest for a number of reasons. One reason, as I just stated earlier, that most of the folks that I have practiced with in my clinical career have been black boys and men, and oftentimes black mothers, uh, uh, romantic partners of black men often encourage or in the children's case bring them hoping and having an explicit hope that there is a black male therapist in whom that black boy can see. And then, of course, black men have and continue to freely contact me and the practice in which I work in, looking for a black male therapist. And so when I heard this conversation or saw this conversation, I became very piqued in interest because my experience and the experience of the black male therapist that I know is a bit different than this experience of this black female therapist who was recounting the feelings of this black male patient. Many of the black male therapist colleagues that I know often have large numbers of black boys and men on their caseload as well for various reasons that I've mentioned earlier. And so I wanted to think more deeply about what black men and black boys need clinically. But before I get there, I do have some thoughts about her conversation with this black male patient. And I wondered if she took the opportunity to wonder with him about his internalization of black masculinity. In other words, were there, or what were there any negative developmental experiences with black men that he might have internalized that is now impacting his capacity or willingness to be in close proximity, and I mean emotional close proximity with a black male therapist. Because I think that that positionality of that patient is not just of interest in a clinical context, meaning it's not just important to explore related to the potential of what he could work through with a black male therapist, but I think that that sentiment could possibly transfer in other relational contexts in his life. And so I think it would have been, and maybe she did, would have been important for her to wonder about that with him, to be curious about any trauma, any negative internalizations, and how that could impact his capacity around vulnerability and connection with black men and black males in general, or in other relational contexts in which he might find himself in. I think it's very important for us, even if there was a female who didn't want to see a male. It's not that we would demand that the person take a chance right then and there, but that it might be something, as we call it in the clinical world, grist for the meal, something to be thoughtful about, something to think more deeply about that might connect to or with other presenting problems or issues or concerns that that particular patient may bring up or bring to the therapy. So I think it's really important for that type of curiosity to happen in sessions, particularly as it relates to black masculinity and black males. I do think that there is a corrective experience that can be had when black males are treated by other black male therapists. Corrective in the sense that the black male patient has the potential to see a more positive image, a more positive psychological profile mirrored to him through the black male therapist, one in which perhaps he has not been acquainted with thus far, and so that he can then reality test or begin to heal from, or begin to see the possibility of himself, to see the possibility of who he can be by the mirroring of that black male therapist, and the possibility of vulnerability in close relationships with other black men or males, particularly if that black male has had some sort of trauma that has been muted, that has been as a result of other black men or males in his life, and having that black male therapist who creates a firm holding environment based on love, non-judgment, can in fact be so powerful and so corrective in the psyche of that black male patient, not just in the context of his own identity as a black male, but also from a relational context. It has the potential, the possibility of helping that black boy or that black male take a risk and to imagine new ways of relating, not only to himself as a black male, but as well as relating to other black males and men that are in his life. We need more black male therapists. We need more black male therapists who are interested in treating, sitting with, alongside black males throughout their process. When I sit with black males, some I've treated for years, some for months, it is always a magnificent opportunity to, one, continue to understand my own self, because many of the things in which black men and black boys bring in their therapy, I may have experienced subjectively or have some knowledge of what it means from a racial context or racial identity context. And of course, having done my own work, I'm not pulled into the patient's or the client's subjectivity in a way that doesn't allow me to continue to hold him and to continue to have a safe holding environment. But there are things in which are helpful to me in understanding the variability of the way in which black men navigate and black boys navigate their identity categories and their lives. And so it constantly allows me to stay not just hip, but stay grounded and open and curious, not having all the answers, and understanding that performance of black masculinity, or the way in which black boys and black men make meaning of their race and gender, are not homogeneous. And so I'm always learning, always growing, always developing, and in my understanding of black masculinity in its complexity. The other thing that I enjoy about treating or sitting with black boys and men is building that relationship. I often tell colleagues that if you were viewing our sessions, you might say, "Oh, this is a older brother talking to a younger brother, or a younger man talking to a father, or homie to homie," because I work from a relational perspective, and I think that black men and black boys, particularly as it relates to the traumas of racism and sexism and being invalidated, often do not need prescriptive, manualized treatment. They need someone who can sit with them, who can hold their anxiety, who can hold their depressive symptoms, who can hold the ambiguity of their lives in a way that is flowing and natural, and that allows them to feel like they can give of themselves or share of themselves in a way that's helpful for us to do something with. And so we have conversations where laughter, we talk about politics, we talk about all of those things that are salient to that particular male patient in a way that's very conversational and relational. But when you see what I do in therapy with black male patients, you can see that there is work being done. Patients are always talking about the psychological insight and the spiritual insight that they have. And when we come back from a session to another session, they often remark about having sat with something that I said, that it messed up their week, and they had to do something with it. And so through the relational context and the mirroring, it allows us to challenge and to provoke within them a new possibility or potentiality of seeing themselves in new ways, and understanding their symptoms of depression, anxiety, fear, anger, rage, are a symbolism or a manifestation of something deeper that needs to be more deeply unpacked, reflexively understood, and then we need to walk it out, and we need to shift and take a risk to do something different in that particular area in which they may have been struggling with. And so, as you can see, I can talk a long period of time about treating black males or sitting with black males. I enjoy it. I learn something new about myself every session. I learn something new about the multiple caveats of black masculinity, and it allows me to give back. It allows me to mirror. It allows me to sit with a population that has been historically and contemporarily dismissed, invalidated, discussed from a deficit model. It allows me to see that no, black men, black boys are capable of emoting, are capable of deeply understanding themselves, and are willing to go through that process when the circumstances and the context feels right. And one of the contexts in which I think allows many black boys and black men to do this type of work is sitting with a black male therapist. I want to encourage, and this is not to say that black female therapists are not indicative or important to black boys and black men in therapy. I think that there are situations and times in which black men, of course, have made negative internalizations of black femininity and black females, and they would do well as part of their healing to sit with black female therapists and to work through that relationally, but to also be able to imagine new levels of vulnerability and relationship with women and females as well. So this is not to say that black men or black males should only see black male therapists, but I do think it is highly indicated, and it is an important part or can be an important part of black male healing. I want to encourage black men who have sons who are about to go to college, or even sons that are not even college age. Talk to them about being a therapist. Google with them black male therapists. Let them see black males being in the healing business, and maybe it's not for them, maybe it is for them, but open up their access to their imagination of what they can be and what they can do. And if you're a black male who is in college or finishing up college and not sure what you want to do, I want you to sit and possibly imagine this as a career, emerging as a black male therapist, as either a social worker, or marriage family therapist, a psychologist, or LPC. Think about it, explore the options of seek out black male therapists or psychologists that are teaching in master level programs, and talk to them, or people that are practicing in the field, and hear about what they do. Perhaps you haven't never had an interest to do it, to be a therapist, but you never know what could emerge in you and through you as a consequence of being connected to black male therapists and psychologists who are in the field currently. It is my affirmation, it is my knowing that black men, black boys have the capacity to heal. They are not deficit. They are not toxic. They are not narcissists. These are all terms in which are part of European epistemologies. But they do nothing to help us understand the nuanced reasons for behavior and psychological functioning, particularly with black boys and black men. But I want to encourage us again to live a life that imagines seeing black boys and black men from a place of love, from a place of growth, from a place of joy. And I encourage us all, if you are a mother or a father, brother, uncle, whatever you are, whatever you have context with or connection to black boys or black men, and you see that they are hurting, and you see that they are in need of someone to sit with them, refer them to a black male therapist. Help them find a black male therapist or a culturally competent, holistic therapist who has done his or her own work and does not perpetuate racist, microaggressive, sexist conceptualizations and interventions with black male patients. Again, this is Casual Conversations with Dr. Gadsden. I will see you soon. Have a great day.